we have our last segment with Jeremy Friends from Cone Health. He's been answering your questions about the updated COVID booster. All right, this next question is this booster going to be a yearly shot? And then my add-on question to that is it going to be like every fall, or are we expecting another booster maybe in the spring?
Yeah, so I don't know. I don't think we know the answer to that question today. Some people do suspect that we will have to get a booster each year to be protected against COVID, and it may be similar to the flu vaccine that we get now, but we don't really know the answer to that question today.
All right, and we don't know whether they're working on something for the spring. I guess we'll have to know that if there's another variant that pops up.
Yeah, the technology, this mRNA technology, it's pretty nimble, and so if the variants change, the manufacturers can change the contents of the vaccine I wouldn't say it's easy, but it can be done.
Just like they do with the flu vaccine on a yearly basis too.
Just like,
okay.
Just like that.
All right, so this person's asking, should I take anything like Tylenol or Advil before getting vaccinated to get ahead of those side effects?
Yeah, so if you're getting the booster, you probably know what happened during your primary series. And if you did get some fever or chills, you can take Tylenol or Advil, and that might help with the side effects.
I know we've had a question about COVID surge, and they were wanting to know whether they should wait to have that booster until the surge. Are we seeing things go back up again? I'm wondering, you know, as it gets a little bit colder, as we go inside more.
Yeah, the data seems to be, it's pretty stable for now. Well, we're definitely not seeing a surge right now. It seems to be pretty even, but definitely patients are still getting COVID, and they're definitely still coming to the hospital with COVID.
And with that said, I know, you know, it's going to be the holidays very shortly and that kind of stuff. We're all going to be inside. We're all going to be gathering together. What do we need to keep in mind when it comes to COVID this year?
Yeah, so if you're sick with COVID, that means you have to stay home. If you have those COVID symptoms, fever, cold symptoms, you can get tested. And then if you're positive, definitely stay home. You always want to practice good hand hygiene. That's just a general rule. And if you're in an enclosed space, then you can wear a mask if you want to. That may protect you against COVID, and you can also practice social distancing. You know, you can stay 3 to 6 feet apart from the other participants in the party. So a lot of folks still don't have their taste and smell. Is there anything out there that, you know, helps that or has been shown to help that? I am not aware of anything that can help those senses come back. Unfortunately, I'm just not aware of any remedies for that.
Yeah, I know somebody who it's been like a year and a half and still no taste, no smell. All right, so as we're wrapping things up here, what is your last thoughts on why people should get vaccinated or get the booster?
Okay. Well, you know, the pandemic's been going on for about 2.5 years. And we can all get some COVID fatigue. I know I certainly have it.
Yes.
But, you know, one of the best things you can do for your own health and the health of those around you is to be vaccinated against COVID. And to be fully vaccinated now, that means to get the booster, this new booster, which protects against the most common strain that's circulating in the United States and North Carolina right now.
Okay.
So get it if you're eligible.
All right, we thank you for your time and your expertise. You can find a full recap from today's Q&A on WFMYnews2.com. It'll be there in just a few minutes. You can click right there in the Who Wants to Know section.